This is a Whirlpool. It's indicated during the treatment of wound management, and especially during the acute phase when the wound itself needs to be cleaned off. We use one of those pads, which is an antiseptic powder, and it's also contraindicated for diabetic ulcers or venous ulcer, which because they are in a dependent position, so we not promote the flux of blood toward the heart. So the machine itself has a motor right here. It has an agitator right here that I have to open up when it's filled up with water, and a thermometer here for the water temperature. And just right here we have the water thing. How do you call that? I don't know.
Yeah.
Hot water and cold water. Here's the water temperature. Ready? Okay, so I want the water temperature about 100 degrees Fahrenheit, no more than that. And whenever the water is a high enough level to cover the agitator and the limb of the patient, I would just turn off the motor right here, and after that open up the agitator to make the air go through the water. Yep. Okay, so I'm having Harry just putting the leg beneath here. Let's consider that Harry has a wound in the medial side of the right leg. So what I'm gonna do is just moving the motor on this side so that the water flux will be straight on the wound. Okay? Now I'll take one of these pads, which is the antiseptic powder, the magic antiseptic powder. Put it right there. And then I will turn on the motor, which is gonna be loud, try to speak louder, and then open the agitator right here. So the powder at this point is dissolved in water, and now the machine is actually cleaning the wound. I'm gonna keep the patient here for about 30 minutes. Okay, so at the end of the treatment, I'm gonna close the agitator. Open. And turn off the motor right there, and then I take one clean towel and ask the patient to take the leg off like that. Okay, Harry. And then I just have to open up the valve to rinse the water out. Okay, now that's the water is drained. I'm just gonna go check for any skin abrasion or something different on the foot of the patient and do some documentation.
We're going to be talking about Premod today. Premod is a modality where we use for pain management. We're using electrical stimulation to induce the gate theory, where we can block the pain messaging to the brain. So pretty much we'll be working with the Dynatron 950 Plus. It's a pretty good machine. What you want to do when you're talking to your patient is a few things. You want to check first. You want to ask about their any contraindications, such as a pacemaker, especially a demand pacemaker. We're worried about malignant tumors in that area where we're going to be treating. We're also concerned about open wounds in that area. Those are pretty much the main things we want to talk about. Precautions: if she's pregnant, if there's a female patient, is the patient pregnant? That's something you want to ask. Also, we want to do sensation tests, which is very important. We're mostly most concerned with sharp and dull with our patient instead of the hot and cold. But for right now, you're better off with just using this. After going through all those parameters with your patient medical history, surgical history, etc., you can begin treatment. But first, we're going to imagine we're dealing with a lateral epicondylitis. So we're mostly concerned with the extensor mass on the hand. If you want to get your patient to maybe do the movement so you can palpate the area. So for you, Toby, can you extend you? So right now I'm going to get the nice extensor mass right here, okay? It's having some inflammation here, it's having some pain, tennis elbow. So we're more concerned with that area over there, right? Also, you want to get the right pads. We're going to use Premod because Premod is used for mostly small muscles and pain management. Usually we could use IFC, but that's usually for larger muscle areas such as maybe the quads, the back. But for right now, we're going to use Premod, so we're teaching that. So we're going to be using 2 pads, 2 electrodes. Now you want to put it on, now electrode placement is very important. You want to make sure you place it on the muscle belly so the current can go through it smoothly. So like I said, you want to palpate, get that extensor mass right there. So get over here and over here. You want to have some nice contact with your pads, okay? You can either apply alcohol to it to clean it, and also clean the area as well, so you get some good, attachment of it, so you can kind of relax. So right here, making sure that I place it on the muscle mass. I'm not on any type of bony prominences. It's a big no-no in this field, so I don't want us to touch anything that's bony, okay? Be right on soft tissue, palpate that area. It's okay, you touch them. Alright, so now you know about pad places. But first things first, you don't want to have pads on the patient's arm when you're turning on the machine, so let's first take these off. So now my connected. So turn on the machine. Power button's in the back. Thing is, you don't want to shock your patient when these are on when the machine turns on. It can happen. Safety first. Okay. So the machine's warming up. As you can see, some of these pads are not sticking as well. So what you can use is a wrap. Just wrap around it, make sure it's tight. Go around the patient. You go around 2 times. Make sure it's tight. We're gonna use the same one. Do a nice figure 8. Go around that one. I want to ask your patient, is it tight? Is it okay?
It's okay.
Okay, everything's good. Okay, he can just go back. Oh, patient's fine. Towel's not necessary, but it's just for being comfortable. Alright? Okay, so now let's get into Premod. So now, patient's connected, everything's good. You want to keep the wires out the way. You don't want anybody tripping over them. Very important. So, for Premod, it has its pre-settings. Pulse or frequency is usually about 80 to 150 pulse per second. You're looking at pulse duration of 125. Alright, so patient's now ready to go for Premod. So before we start, we want to get to the option Premod at this button right here. So all you're gonna do is press it once. First it goes to IFC. Press it again. The green light is now on Premod. Okay. In Premod, we can adjust the time. Since this is our first time here with our patient, we're going to go with about 10 to 15 minutes, but for right now, 10 minutes. You can also adjust the frequency. It's between 80 and 150 pulse per second, as I mentioned before. That's usually if the patient can tolerate some of the amplitude that you adjust it to. So right now we're gonna leave it at 80, starting low on the low end. But right now, as you can see, we can adjust amplitude. So right now we want to get to produce a tingling sensation. So I'm going to just increase it with the up button. So I'll just ask the patient. Right now you're gonna be feeling a tingling sensation. Please let me know when it's comfortable. All right. So now I'm gonna start it. As you can see, these lines are going across. That's the conductivity that you're seeing right there. Feel anything? Nothing?
Yeah, no.
Nothing? Okay. Every patient is different. Some patients will have low amplitude, some are high.
I feel something.
You feel something? Is it comfortable?
Yes.
You don't see any type of muscle activity, just a sensation. So let's go just a little bit higher. How's that? Is that comfortable?
A little more.
A little more? Okay.
All right, a little lower.
Okay. You told me to bring it
All right.
lower. Right there. Stay right about right there. Okay. Conductivity's here. We're at about 21 with the amplitude. Is that a pain where he's called having sensation? We want to make sure that there's no type of muscle activity, as I mentioned. And with that said, let's also keep it on low since it's a small muscle. How does it feel?
Feels good.
Still hasn't changed. Okay.
Tingles.
Tingles. All right. So that's what our patient's getting. And now, most importantly, we're going to start our procedure. Time's going down. It has now begun. Just a few things to mention. When the procedure is going on, when the numbers are going down, there's a few things you cannot adjust. You can't adjust frequency at this moment. Okay, that's something you might want to fix when you're getting your parameters correct. What you can do is modify this right here, low and high. It's also the with frequency, but it only goes within the parameters. So for low, you can use that for smaller muscles, high for larger muscles, and also for certain areas such as the back, you can also have the machine alternate between high and low, since there's a combination of large muscles and small muscles in that area. But for the time being, since we're working with the extensor mass, we're just going to be working on the low end. Okay, so now maybe you have to cut your session early. There's a few ways to turn off the machine, or turn off the procedure. You can either lower the intensity all the way down to 0. Also, you can also lower the time. It'll go in by minutes. And you can also press pause. Stop. So right now I'm just gonna lower the intensity down to 0. Okay, for certain cases, for irregular spaces where 2 pads are not able to cover the painful area, you have to go with a technique called unipolar. What you'll want to do is have your smaller pad placed on the area of pain, so there's a direct concentrated current to that area, whereas you'll have a larger dispersive pad, so going on a larger muscle. This area shouldn't get any type of sensation. Might feel some, but it's mostly focusing on this smaller area over here. Same parameters for as Premod, just as with 2 electrodes, it's just that one is smaller than the other. And as I said, this is a dispersive pad we have here. Goes to a larger muscle. The electro stimulation is more dispersive and widening out, has a wider area of disbursement, making it less concentrated. Whereas the smaller pad focus on, let's say, the thenar eminence or the carpal tunnel, or I think thenar. We could place it on these irregular spots, as so, and that's Premod for you.